The hip is a ball and socket joint, and I'll show you with this model here. The ball portion is the femoral head, which is at the top of the femur or the thigh bone, and the socket is the acetabulum, which is part of the pelvis. The hip also has a labrum, which is a special piece of cartilage here that deepens the hip socket, as well as capsule and ligaments that hold the femoral head in the acetabulum. Hip arthritis involves the loss of cartilage, usually at the top of the femoral head and at the top portion of the acetabulum or the hip socket. When patients develop arthritis, this causes pain and often limits the range of motion of your hip. So patients come in and see us in the office, and the most common thing that we hear is pain in the groin region, as well as difficulty with activities, especially something like tying your shoes. Treatment of hip arthritis starts with non-operative management, usually with physical therapy and anti-inflammatories. If patients have tried this, or if they have very severe arthritis, then often hip replacement is the next best step. In a hip replacement, I perform an anterior approach to the hip. What that means is I make an incision on the front part of your hip and dissect in between the muscles to get down to the hip joint. The first thing that we do with the surgery is make a cut with a special saw to remove that diseased portion of the femoral head. The next thing that we do is we clear out the cartilage and the labrum in the hip socket, and we place this titanium shell, which looks like this, that's held into the bone by friction, and the bone will eventually grow into that implant. There's also a plastic liner that locks in, that provides a surface for your hip replacement. The next thing that we do in the surgery is we insert the femoral component, which looks like this, or the femoral stem, inside the thigh bone, which sits there like this, and then we place a ceramic ball on the top of the femoral component. What we're able to do in surgery is put the hip in its appropriate spot and take x-rays. With x-rays in surgery, we can very accurately recreate the normal anatomy of your hip, and we can make small adjustments such as lengthening or shortening your leg to reproduce your normal anatomy in your hip. Because the hip is a ball and socket joint, we can very easily recreate your normal anatomy, and this leads to a very natural feeling hip. If hip pain is limiting you, or if you're considering a hip replacement, we invite you to come into the office for an evaluation. We'll come up with a great personalized treatment plan for you and do our best to get you back to an active lifestyle.